relatives can be relatives again. So they can actually sit and hold their relative's hand. My name's Katy, I'm the Deputy Manager for Hospice at Home. We cover the day and the night services in people's own homes. So we see people with a prognosis of 12 weeks or less. And we can either spend the whole night with a patient from 10 o'clock at night till 7 in the morning, or we can do slots within the daytime. And the idea of this service is to help patients to die in their place of choice, which can be at home, could be in a residential home, whatever they consider their home is where we would help them to be cared for. And the main areas that we help with are through physical health, obviously, is through things like repositioning, personal care, pressure area care, continence care, all the physical sort of care that we can help to make someone as comfortable as possible. But on top of that, we have registered nurses and healthcare assistants who have got a lot of palliative background, who assess the patient, they help with education. So going through, what is it to look for? How can you tell if somebody's not able to communicate? How can you tell if they're comfortable, if they look like they're deteriorating, if they need any extra support? What is it that you might need to help make sure that patient can stay at home and can be cared in their choice? So that's one of the main areas, and we'll help with, if carers are going in, we'll help with education with them, with family. And one of the really big positives in this role is that relatives can be relatives again. So they can actually sit and hold their relative's hand, or their friend's hand, or their mum's hand, whoever it is, and actually talk about memories and be family, and just listen to music and hymns, or whatever it is that they want to do, and be relatives, knowing that there's somewhere to actually provide that care for the patient, rather than them having to be the carer as well. The other part of our service is what we call the roaming service, and that is a service which is normally a registered nurse and a healthcare assistant who travel around the Derbyshire area, and they are called out. So anybody with an end-of-life diagnosis can phone them, and that could be for various reasons. It could be for symptom management, it could be for questions, education, psychological support, it could be for verification of death, so when somebody has died they can go out and support the family, do the verification, help with any sort of care needs, and go through what people need to do after somebody's died. They also go out and do a lot of symptom management, so if people are experiencing any of the symptoms at end of life, they can help by getting out quite quickly to people to be able to provide that, be it non-pharmacological care, such as helping to reposition someone to drain secretions, or it could be something like giving medication to help relieve symptoms. But again, a huge part of their role is education, to help families know what it is to look for, because if you've never cared for somebody at end of life, it can be a very scary situation. People are amazing to keep their relatives at home. They have to do things that maybe they're not within their comfort zone, and we're there to support them to be able to help, along with the rest of the community services, to help keep them at home if that's their wishes.